All right, welcome to the Woodland, everyone. This is Andre Tomlin from Mental Elf, and it's a pleasure to welcome you to the Digital MHQ webinar. As you can see, we have a panel of lovely experts from across the world of mental health, and we're really delighted to be spending at least an hour, maybe an hour and a half, if Victoria's kids and the dinner can wait, on discussing the research priorities for digital technology and mental health. So I guess this is the culmination of almost 2 years' work, I think, a big project which Professor Chris Hollis and Matt Rawsthorne are going to be presenting at the beginning of this meeting. We're then going to have a discussion here amongst the panelists. And, oh, hang on, I nearly forgot. No expense spared. You can't see that at all. That's Digital MHQ. That's the hashtag for today. So if you have any questions or any comments, get yourself on Twitter and make sure you include hashtag Digital MHQ, mental health questions. And we'll be looking at those and we'll put those to our panel if they are not too rude. So we're going to start off by handing over to Chris and Matt, and then the other panelists will introduce as we go along. So yeah, over to you guys. Give us an idea, first of all, of what you've done with this project and share your screen so we can see your presentation.
Hi. Great. Hello everyone. Great to be here. Thanks, Andre, for setting this up. Matt, would you like to introduce yourself?
Yeah, so hi, I'm Matt Rawsthorne, and I started this project as a young patient, seems so long ago. But yeah, I was part of the steering group along with some other patients and carers that was formed to help guide this project. And that's a point I want to make from the off is the efforts that have been made to gather a range of perspectives on this. So I'm going to talk through a little bit about the process and then hand over to Chris, who's going to talk about the outcomes. Chris, do you want to introduce yourself?
Yeah, so I'm Chris Hollis. I'm Professor of Child and Adolescent Psychiatry in Nottingham and the Director of Mindtech, and I'm also the lead for this PSP. And it's great to have Matt here because I think the methods that we use are as important really as the results that have come out. And I think Matt's going to start by telling us how we did it. I think Andre said it was about it's actually over 2 years. I think I'm kind of going back to the early 2016, you know, when we initially had the first seeds and ideas of doing this. So it does take some time, and it's great that it's come to this fruition. So Matt, do you want to tell us about how we did it?
So I've got some slides which I'm going to share. Let me see if I can bring this up. Okay, so hopefully you can see my screen, and I'm going to put on.
Yeah, that works fine, Matt.
Okay. So just to say, Mindtech is a research centre that's based in Nottingham and funded by the National Institute for Health Research, which is the research arm for the NHS. But this was definitely not a solo effort. We had lots of partners, some of whom are represented this evening. And the full list is on the research paper, which will include all the things I forget to say as well. And we were helped in this by the James Linder Alliance, which is not itself an organisation, more of an initiative about finding the best evidence for care. And this was originally based on the work of a guy who did the trial on lemons for scurvy. So it's got teeth. So with them, we followed what is a well-regarded evidence-based process. And what we were after was trying to find out what are the unanswered questions about digital technology for mental health, and not just what are our questions, but what are everyone's questions, and then get all those people who are involved to say, okay, which ones are the most important if we were going to divert scarce research resources into this. And the people who count in this, as I said, there's already a wide range of stakeholders in terms of organisations, but it's people living with these illnesses, like myself and the other people on the steering group, the people who care for them, and I mean that in both senses, of formal carers, health and social care professionals, and also the people who do most of the frontline delivery, which is usually people within their family. So we made a great effort to reach out. The danger here is that we would miss the people who can't already access this kind of technology. So we didn't just go out there and put it on as a web survey. We also held workshops with people who are likely to be more excluded from this. So you might have heard the expression, the digital divide. And through that, we got a load of questions, which was a shame. It generated a lot of work from a wide range of people. And then it was up to us to figure out, okay, which of these are the same questions, just phrased differently, which of these are out of scope. So that meant coming up with a definition of what was in scope, what do we count as digital mental health technology, and where some of these questions actually, had they been answered, so there was a whole stream of work around looking at the current evidence base and seeing whether actually, no, we know this one. And what was surprising was actually we don't. There's an awful lot we don't know.
Just to say, Matt, on the stakeholders, what made it different, I think, from other initiatives, and there have been expert consensus groups doing this sort of thing in other countries, and they tend to be people that you'd expect, the usual suspects of academics and policymakers and tech developers. So this was really very different, and we actually excluded developers from, so this wasn't driven by technology, and that's probably also will influence the kind of questions that emerge from this.
Yeah, I mean, if you think about typical medical research and who drives that, it's actually people like the pharmaceutical industry who are in it because they're trying to then create a service, whereas this was much more patient and carer-led from the start, to the point where meetings where there wasn't a quarry of those different types of people wouldn't be allowed to make a decision. So there was a real effort. And I'm doing a lot of work now on what is good co-production and research, and the key to that is sharing power. And so there were definite structures in place that we can learn from and reuse here about how to balance those different opinions.
Yeah, and so, as a result, these are not my questions, they're not Mindtech's questions, these are questions which have emerged from this process, and part of it was that we had to accept that some we may not even agree with, or we feel they may have missed something out, but this is what you accept when you go into this process.
And so there was a lot of compromise and horse trading and people trying to really get to the questions behind the questions, if that makes sense. So trying to understand what are people asking about here, and that was why we didn't just do this as a one-shot. We were repeatedly refining and getting people involved at several stages. So one of the key stages was to create a thematic analysis framework where we could start to see what are some of the key concerns or ideas that were coming out of this. And so we've already mentioned that about who's able to access this, and is digital technology the next health inequality if people aren't even able to get there? Who is it aimed at? And then this whole question around about where does the buck stop? In terms, there's great potential here, but at the end of the day, who is in charge or responsible? And then there were a lot of questions about how does this compare to traditional treatments, and the gold standard within that. Some people were suggesting is face-to-face cognitive behavioral therapy for certain conditions, but actually we know partly as a basis of this exercise that some people have a preference not for those, and actually, so it's a question about the what I might call the Heineken effect. Does these technologies, will they allow us to reach parts other treatments don't reach? So, I mean, so there was a lot of work done, some of it very low tech with bits of paper where people were trying to discuss which one should go in or how we might tweak things to get it all the way down from over 1,500 to 134, which then went out for prioritisation, and then to a workshop where 26 were negotiated down to 10. So what I'm going to do now is show you the video, which summarises the outputs, and then I'll hand over to Chris. Okay, so I'll stop share, I'll do a new share, I'll go to this. Okay. Right.
The role of digital technology in mental health raises many questions. In fact, over 50 after a thorough check of existing evidence, we excluded questions that have already been answered by researchers. Then, through a careful and collaborative process, and with the guidance and support of the James Lind Alliance, the questions were filtered down to a top 10. So now, researchers and funders take note. Instead of drowning in hundreds of possible questions, we can tell you which are the most important to make sure your research has relevance and impact. The number one question and 4 others in the top 10 are about balancing digital technology with traditional face-to-face treatment. We need to know how to get this balance right in order to use digital interventions effectively and to understand any risks of reducing face-to-face interactions. The number 2 question asks whether having a mental health problem affects how people. Understanding this will help design more effective digital interventions. 2 questions in the top 10 focus on safety. For example, when are digital interventions safe and effective across the care pathway? 2 of the top 10 questions are about access. Firstly, can digital technologies increase the number of people receiving treatment? And secondly, can digital technologies help reach more people who are not well served by traditional mental health services? In summary, what we need to know about digital technology for mental health is where and when in the care pathway should digital technology be combined with face-to-face care for the best outcomes? Who do digital technology solutions reach? And are they safe and as good as current treatments? After 18 months of hard work, we have confidence in the final top 10 questions. These have been asked and prioritised by the people who know best, those with experience of mental health problems and the people involved with their care and treatment.
Okay, so I'm going to hand over to Chris now. Chris, do you want the slides up? And he's going to talk you through the rest of the presentation. Go.
Okay.
Yeah. No, sorry, wrong one. It's that one.
That's it. Yeah.
Okay.
And next slide.
Okay.
Yeah, that's great. Okay, well, thanks, Matt. And this is all part of the.
Well, thank you, Mike, for that.
No, not that one.
No. Second scene and the text, the importance of solving.
Challenges.
There we go.
We'll get there. Okay, great. So thanks, Matt. The output and dissemination. So this evening is part of that dissemination process because it's critical that people actually hear and know, and the video was part of that. So we use the whole range of methods. The key output paper is published in Lancet Psychiatry on the 28th of August, and you can see the team of co-authors. Again, some of those are with us tonight, but also this was, as Matt said, a real partnership exercise. So this paper, so if you really want to drill down into the detail, and I'm not going to remember what those top 10 are in every question, but if you want to go either to the Mental Health blog, which covers those, or the real details of this is open access. It's free you have to register with Lancet Psychiatry, but if you go to the journal, you can get access to this paper. And that was something that Lancet Psychiatry agreed with us when we put in the the paper. So that's really important to get to get wide uptake, because clearly we want this work to be taken up and recognized by those who are going to fund research and start developing funding calls, and translate all of these priorities actually into research. So if we just move on to the next, the theme. So we had a top 10 questions, but we actually had 26 actually questions in the final workshop, and you can see those in the paper. And it's I think it's important to go slightly even, to go beyond the top 10, because there's some really important issues being raised by that top 26. And again, if you go to the paper, you can see those. And sometimes with the JLA, some of the questions aren't actually in the top 10, but might be 15 or 16, are actually critical issues, and they get taken up. So don't feel that there's something sacrosanct about the top 10. This is a way of focusing, but we have a wider range. I mean, given the fact that we had something like 1,500 suggestions, there's a lot of reduction, sometimes bringing things together, and I guess our big job is to make sure that we don't lose things too much in that process. So Matt was saying, we were mentioning the key themes, and they came out in the video, and I think the first one is around this issue in the thinking about the implementation and integration of digital technology into care pathways, which I think was really very interesting. And I think it, in a sense, showed that this wasn't just a focus on technology per se, but on the delivery of services and how technology can be brought in, integrated to optimize and improve clinical care. And that really is, I think, quite different from just focusing on a isolated individual technology. Some real decisions there about at the right stages, the issues of blending technology, and rather than perhaps what we have at the moment, which we have rather isolated technologies being delivered without reference to the rest of clinical care. The real next step, I think, is working out the best ways of combining them and at what stage.
I think some of the concerns that we saw through the questions were that it was this either or, which, as Chris says, is sometimes the case at the minute. But actually, how can we do this in a much smarter way to get the kind of best of both worlds, to leverage what the technology does well, for example, pushing messages out on a regular basis, but also keeping the human side of it, which also is of great value to people in a therapeutic relationship.
Yeah. Okay, so I'll just move on to the next theme. It came out very strongly is this question of, does the technology really reach the people that it needs to, and particularly those people who are not accessing care and services at the moment. So something we're very familiar with is this treatment gap in mental health. The fact that certainly in adult mental health services, perhaps 2/3 of people at least don't receive any help for mental health conditions, and certainly not help from the NHS. And in children's services, actually more, it's 3/4. So the issue of digital technology, it's often being promoted as being able to reach that population, but we don't really know whether it is doing that. And it may be that it reaches people who have lesser needs, or it might be people who are getting services, or it might still be excluding people who aren't currently accessing services. So the idea of reach is really important, and this is something where we need studies to demonstrate that this really is something that's changing with technology. So, and then moving to the third issue, I think was something quite fundamental, and it's about the benefits and risks of digital technology, knowing whether it works. There's a vast array of technologies, particularly in areas like the app arena. Most of those, or almost all of those, are not evaluated in any sense. And so the trust and confidence in these technologies is lacking. But even in some of the more formal online interventions, we have research often that shows initial promise in very constrained research designs, but they are often disappointing, very disappointing when translated into real world services, when there's less support from research staff, etc., less motivation for ongoing engagement. And so the type of research we need to know is that given the kind of settings that these intervention technologies will be delivered in, do they work? So they, not just in the classical efficacy studies, but we need more pragmatic studies. And I think convincing people that they are at least as good, maybe potentially superior in some ways, but they aren't a second-class option.
It's something that we're looking at in the study I work on is the measures now aren't just as it good as Chris said, but does it maintain its effects, and do people adopt this? So this is not just about convincing the end user, but also, as Chris mentioned, the support that goes around that to fully embed these, if that's one of the routes we want to go, and the implications. There are questions, as you might expect, around the downsides of certain aspects of digital technology in relation to social media, which also need to be addressed. So this is very much a pros and cons.
Yeah. So I think we're very much aware of risks. So it's about sort of issue of benefit and risk of a range of different technologies, and those risks often perhaps not being so well evaluated in the studies that have been run so far. So just to move on to the top three questions, which pick up some of the themes that we've already heard about. So this first question, the number one, was this issue of benefits and risks in comparison to, in a sense, established or traditional treatment. And I think that question is also about testing that in a more pragmatic way in terms of real world delivery, and being confident in the sense that people are getting as good, if not better, outcomes with these interventions. And of course, there's a lot of big concern, and there has been that issue about the removal of face-to-face contact. I think what these questions bring up is that where we're moving towards is much more blended integration, but we need to know how to do that best and for which technology. The second question was a really interesting one because it was about how mental health conditions actually affect the use and engagement with technology. Again, really not a great deal of research in that area, but this is a question of the design of technologies to make them appropriate and sensitive to the conditions that they're meant to help.
And this is again, it's an area where in standard products you have people like human factors experts all over this, but commonly in this speed of this technology development, those disciplines aren't always on board. I mean, we're lucky that at Mindtech there are people who are very skilled at this and bring this perspective. But it's I don't know if anyone's experienced downloading an app and then never looking at it because you couldn't be bothered. So just that basic idea about what are levels of motivation for people to engage, as well as the opportunities and means to do so.
Yeah, and the third question we've touched on already, this issue of the combination and integration of therapies. So that requires studies that look at combinations, look at the added value often of thinking of digital therapy, not as an either or, as Matt was saying, or as necessarily as an alternative, but augmenting and supporting. And that's really quite a different way that we've thought about evaluating digital technologies. We tend to, again, see them in isolation as freestanding entities, not really being evaluated within a care pathway or within a service context.
Yeah, and I think some of the traditional research models have tried to say, oh no, you can't do that, that's a problem, and where's your control, when actually we're trying to test what the real life effect is, which is there are going to be lots of messy different influences and interferences in how people get to use these.
Okay, so I think those are the, obviously, as I said, you can go and look in more detail at the full range of questions. I'd encourage you to do that, to go look at all of the top 26 actually that went into the workshop. But I think those are the key themes I think that we've seen. So just to draw your attention, tonight we're going to be focusing on these priorities at the Mindtech Symposium in December, on the 5th of December. And again, there's going to be all of the speakers there are going to be reflecting on their own research and how it addresses these particular questions and themes. So I think we'll probably stop there, and I think we're all ready to take questions from our panel.
Yeah.
Brilliant. Thank you, guys. Wonderful. So we're back. Let's get stuck in. Let's ask some questions. So first of all, I think I'd like to introduce everyone, or get everybody to introduce themselves. So let's start, and this is a bit like blankety blank or celebrity squares. Let's start in the top left-hand corner with Dr. Victoria Betton. Victoria, would you like to unmute yourself? Or let me unmute let me unmute you, because you might send your phone flying across the table. Tell us a bit about yourself and why you're interested in digital mental health research.
Okay, so my name is Victoria Betton. I am a cog in the wheel of mHabitat. We're an NHS-hosted organisation supporting digital innovation in health broadly, but a lot of the work that we do is in mental health, and my background's working in mental health. So I've been involved in this James Lind Alliance process from the outset. I guess we work with industry, with academics, with frontline practitioners, with people accessing mental health services, and we're struck, as Chris mentioned, by actually the lack of good quality evidence about what works and what doesn't work. So, I was really keen to be involved in this process, to contribute to and be part of the conversation about how we can improve evidence and evaluation and really understand the role of digital within the mental health sphere.
Brilliant, thank you. Professor Miranda Walpert, I think you're next in line. Miranda, do you want to introduce yourself?
Sure, hi, I'm Miranda Walpert and I'm Professor of Evidence-Based Practice at UCL.
Oh, sorry, Miranda, you're very quiet on the connection. Is there any possibility you can turn your microphone up a bit?
Let me see if this will help.
While you're doing that, I'll move on to Mark, and we can, move on to Sean, and we'll come back to you in a second. So Sean, do you want to go ahead and introduce yourself as well?
Yeah, sure. Can you hear me?
Yes, that's great.
Okay. So I'm Sean Oshonaike, and I'm the CEO of Cypher app. So it's an anonymous social network app for supporting young people's mental health. Our interest in terms of mental health research is around how we're interested in how we validate some of the interesting work that we're doing in terms of supporting young people's mental health, and also being able to really truly capture the evidence as to the impacts that we're having on young people's mental health across the country. So in our case, for example, we believe we capture quite a lot of insight in terms of young people's mental health. And I think one thing we want to improve on is actually working with the academic industry to actually work with us to be able to get to some more interesting insight.
Great, thank you very much. Miranda, let's come back to you and see if we can hear you now.
I haven't managed to find a way of increasing it yet. So
that's pretty. Maybe just speak up. That's relatively loud now.
Okay, I'll shout.
Go for it.
I just don't know who I'm shouting to you of. Anyway, I'm Miranda Walpert. I'm Professor of Evidence-Based Practice at UCL, child mental health, and interested in how digital technology can enhance our support that we offer to young people, but also aware that there's a big debate within youth mental health about digital technology separate from apps and support as a sort of a negative impact on people's lives, and how one balances those two issues.
Great, thank you very much. Okay, Sophie Dix, Dr. Sophie Dix from MQ. Let me unmute you and you can introduce yourself and tell us your interest in this area, please.
Oh, hi. Yeah, well, I mean, we're interested in funding all types of mental health research, but really seeing an explosion in recent years around digital interventions. In fact, one thing that's really interesting is that we're approached all the time by app developers to endorse their work. And I think the key thing around everything is evidence. We heard recently that there's now, I think, something like 320,000 health-related apps now in an app store. And, you know, how many of those have actually got an evidence base behind them? But it shows that the public are really wanting app-based interventions. And I think anything that sort of builds the evidence base and actually makes sure that they are getting evidence-based help as opposed to an app developer's perception of what help is, then that's got to be a good thing.
Well, we're definitely going to talk a lot more about the evidence that can be produced from these questions. I think that's a big question for us to answer as part of this webinar. So yeah, thank you for that. And we've also got Professor Kathy Cresswell from Reading University joining us. Kathy, do you want to introduce yourself?
Hi, yes, I'm a Professor of Developmental Psychology and an IHR Research Professor at the University of Reading. And my focus is really on child anxiety disorders. I'm also the lead for the Emerging Minds Network Plus, which is a new network that's going to start in December, which includes Andre and Sophie and others who, and what we'll be doing there is really trying to push forward research that will make a difference to children and adolescent mental health. And so one of our focuses will be on digital mental health and how we can contribute to and facilitate research there. So these priorities are really useful for us. I think my particular interests and reasons for interest in this are that in the field of child anxiety disorders, we have some effective treatments, but we know that actually very, very few children who could benefit from them access them. And obviously digital interventions give us a great opportunity to increase access to effective treatments. But the other thing that excites me about the potential of digital is because you have built-in ways of ensuring fidelity to treatment delivery and ways of making these sorts of interventions really scalable. It gives us a really great opportunity to be increasing our understanding of what makes particular treatments work well for particular people. And I think that's a real positive about digital interventions. So those are really my two main driving forces.
Great, thanks very much. Okay, next up is Kat Cormack. Thanks for joining us, Kat. Kat's from ZenZone, and yeah, tell us your interest in this field. Kat, can you hear us?
Hi, yeah, my name's Kat Cormack, and I kind of have two hats on with this project. So, yeah.
Yeah, go ahead.
Can you not?
Yeah, we can hear you. Yeah.
I'm a service user, but I also work for ZenZone. I basically been using mental health services for half my life now, but digital's been the thing that's really saved me, I think. I started running my first support groups online when I was 13. So that was 16 years ago, and that's led to different opportunities for me, getting into actual face-to-face mental health services and actually my career.
Great. Thanks a lot for joining us, Kat. I think there's maybe a little bit of delay on the connection with you, so I think you're hearing us maybe 5 or 6 seconds after we're speaking, which is why there's a bit of confusion there in the conversation. Okay, and finally, we have Mark Brown. He's that Mark 1 in 4 off of Twitter. Mark, do you want to introduce yourself and, yeah, tell us about your interest in this area?
Right, so I'm Mark 1 in 4 off of Twitter. I'm Mark Brown. I do mental health stuff and do loads of different kinds of mental health stuff. So I write about mental health and think about mental health and I've worked with a number of people, including Victoria, that you can see on your screen if you're looking at the gallery view of this conversation, working on trying to make, ultimately, like, think about what my project is. I'm looking to help make a future for people with mental health that isn't absolutely effing awful. And I think that's the really important thing, thinking about research in terms of how we make not just digital futures, but the future in general, better than the present is for people with mental health difficulties. And I think that's broadly where I'm interested in this from. How do we make things that aren't terrible? And how do we make sure we make things that are meant to make things better, actually make things better, rather than making things worse in different ways or for different people? He said forcefully from his log cabin in the woods.
Mark is not in a sauna in Gothenburg. He's in a log cabin in the Lake District. All right, brilliant. So that set this up nicely. So I thought we'd start, and we've got some questions coming in on Twitter already, but I thought we'd start just by opening up the floor to you guys on the panel, and for you to kind of comment on what's happened with this James Lind Alliance priority setting partnership. It's not a mouthful at all, is it? What do you think of the questions that have come from citizens and clinicians on this project? Are there any surprises here? What questions do you have for Matt and Chris and the team? Yeah, Victoria?
I can ask one. So I just wondered whether there were any surprises about what didn't get included. So one of the things that sort of struck me is that, you know, the discourse about responsible tech, human tech, around ethics and technology is absolutely massive at the moment, sort of more generally. And maybe sort of questions about ethics are implicit in some of the questions, but I just wondered whether Chris and Matt could talk to that topic area and whether they were surprised that questions around ethics didn't come out more strongly.
Yeah, I think, as you said, there was a lot of it that came through not, I don't think I ever saw a question that said ethics explicitly, but there was a whole load of stuff around safeguarding in particular. There was also something else which I think came out, which is about what is the standard that we compare these things to, because if 2/3 or 3/4 of people can't access or don't access treatment, then is the standard 0 as opposed to you know, the gold standard of so many sessions of CBT. I was part of a clinical trial for mood disorders, and we had hundreds of people on the trial. The average time to reach the right treatment was 15 years. So there's this whole question here about what is the potential for this, and also I think so there was some hints around what are the trade-offs going to be here, and that's quite common with where you're looking at things which are treated like a public health or a population-based solution, about who does that leave behind. So I think there are if you look for them, but I don't think that was because we cast the net wide in terms of not so much researchers as practitioners and patients and carers. It didn't come through in that language. Chris?
Yeah, no, I would agree with that. I think it was interesting as well that the focus of a lot of questions was on, I suppose, what we would see as existing technologies, things which perhaps we're less excited about, to be honest. And a lot of the debate around ethics, around issues like artificial intelligence and machine learning and algorithms and you know, virtual robot agents taking over therapy or whatever, didn't really come up at all. Maybe because those were seen as slightly, you know, futuristic or not that important, and actually the nitty-gritty issues of actually getting hold of some intervention support were what were preoccupying people, and how to make what we already had better and more accessible. So I was kind of surprised by what also wasn't there. But then when you think it wasn't driven by technologists and futurists and whatever, that's perhaps not so surprising. And the questions were not, by its method, not highly specific. So we didn't get a lot of questions about, what about virtual reality in people with, some anxiety disorder, or they weren't of that nature. They were much broader. Now, you could begin to break the questions, the principles down into those sort of questions, and they may become applied in that way. But these are, I suppose, more overarching themes in a way, rather than very specific research questions.
It's interesting, isn't it? When you do these sorts of projects, I've been involved in a few of the mental health research priority projects over the years, you always end up with a bunch of questions asked by the public, which are very different to the questions that research has answered so far. It's more different in some areas than others, but that's, for me, one of the really exciting things about this is that it is coming up with a list of questions that matter to real people, rather than just those weird researchers that just spend all their time in basements. But for this, it's a bit of an odd one, isn't it? Because there's very little, as Victoria said already, there's very little research in digital mental health. So we don't really have much to compare it to.
Yeah.
And I was quite surprised, as you say, that it didn't come up with more, of the exciting tech stuff that researchers are doing now. Earlier on this year, Dan Freeman and his team in Oxford were given, what was it, £4 million to research VR for anxiety and other mental health conditions. So that's where the money's going at the moment. So is there already a disconnect between the sorts of basic questions that the public are asking about tech and where the money is being spent?
I think, well, the evidence review that we did, there were only 3 questions that were asked that had been answered. So I don't know whether it's that the money is being spent in the wrong places, partly as much as there isn't that much money in mental health research, full stop. So I don't know. I found it really interesting because I work on a project that came, the priority setting up partnership came after it was set up. But we're still now trying to use the concerns that came up in the dissemination of it. So although it's not a research priority being set, actually now we're thinking, can we repurpose some of that to try and answer these questions, partly to show its relevance, but partly because actually we didn't know when we started exactly what we were going to find. So I think it's also to point out that this isn't just about setting research priorities, it's actually shaping the whole process of research.
I wonder if we could ask some of the people with, this is a bizarre thing to say, can we ask some of the people with lived experience of mental illness and mental health, like all of us on the panel, to kind of reflect on the questions? And, were you surprised by these questions? What did you think of them? What's your sense of whether this is correct or not?
Can I have a go?
Yeah, go for it, Mark.
It's interesting. I looked at the questions. I was involved in at least one of the priority setting days, and the questions we kind of came out with at the end, it feels like they are focused at what has already happened in technology and mental health rather than what comes next. And I kind of think, for me, there's a lot of different domains of potential question. And a lot of the questions we came out with in this process were about reassuring the public in one way or another, reassuring people who experience mental health difficulties that the world isn't going to be terrible. And they didn't really, for me, address how we make this coming world. And I think that's the really interesting thing that happened to me. So what I feel like is, for a lot of people, the idea of mental health and technology is happening in some place a million miles away, and most people aren't thinking about it in the course of their everyday life. And I kind of wonder, from any of the stuff that was generated from this process, whether it made any suggestions about how we should actually do this stuff, like whose job is it, Whose job is it to pay for it? Whose job is it to think of it? Whose job is it to own it and control it? Like, it kind of just feels like mental health technology exists on some kind of 1950s like satellite rotating the Earth that's not connected to the rest of the world. Was that a sense that, I suppose the question is that, were you thinking and did you feel like this felt like questions about now when you when we arrived at those top 10?
I think, Mark, that's a really good question. I like the metaphor of sort of this thing in orbit, but in some ways I think these questions did address this disconnect, because there was a lot of emphasis on integration, blending, how does, rather than this technology which you get sent off to, you can deal with it separately and come back to your rather sort of old-fashioned way of delivering mental health care. We can't do that because it's just not possible. So I think people were saying, particularly I guess with lived experiences, is how can we not live in these two different worlds? Because you live in this very sophisticated world and things, but actually most of that isn't represented at all in the services that you experience, and that the people who are developing the tech really aren't that involved either with people with lived experience or with the or with services. And I think there has been a view that this is all kind of interesting, but it's for the worried well, or it's for people who don't really have that serious problems or whatever. And if you really have serious mental health problems, then technology is a bit, it's not really, we're not going to be using this sort of thing, anyway. And I think these questions are kind of moving on from that and saying, actually, this can't just be ignored by, the way we deliver mental health care.
Yeah, I think I do see your point about some of it, particularly in the way the questions were phrased. We refer to things which for us might seem really old hat, like Skype, since consumed by Microsoft. But actually, there was a challenge then in the phrasing of how to make sure that they related back to what people had asked, but also had the potential. And yeah, I don't know whether we always hit that right, but that's one of the dangers of a consensus process, is that everyone ends up with something they don't quite agree with, but it's better than what anyone could come up with on their own.
And in a way, to get back to also to this sort of broader issues like Victoria raised with ethics. I mean, I was just looking at the my crib sheet here actually. But question number 15, which is outside the top 10, brought up questions of how can a duty of care be upheld when using digital technologies for mental health. Now, it was interesting that there was a question as to whether these were research questions sometimes. Sometimes the issues that people raised, people are not brought up to coin research questions. So they brought up issues, things that mattered to them. So, and that may be quite difficult to put into a research question, but it's clearly a serious, it's an important issue that people are concerned about. And as in a way, so Mark was saying, this issue about, there is some sense of reassurance. I think the sense of some concern, trust, how can we be confident?
Yeah.
And there's a lot of, there's quite a lot of things that, mistakes that have been made, technology has been presented too quickly without appropriate involvement. And it's really set things back because people haven't had sufficient trust, concern about people, about their data, about their security, about their identity. So people were raising those issues.
I think.
Sorry, Kat, do you want to come in?
Oh yeah, I mean, I was going to say, as a service user and as someone who's kind of spent about a decade campaigning in mental health, it was really interesting to see how the research questions lined up with the campaigning I've seen over the years. And to be honest, as a service user, I really wasn't that surprised by much that came up in that top 10. So, you know, how do we increase reach to hard to reach groups? What is hard to reach? How do we evaluate and endorse these things, especially with apps? I was involved in one of the NHS health app libraries, I think back in 2013. You know, so I feel like I see these things going around in circles sometimes. And sometimes I think, how have we not answered this already? And so it's interesting, and I wonder what's going to come out of some of these questions, because I think it was really hard balance between, you know, what people like me as a service user would want to know and would actually care about, because, you know, I think a lot of people just want something that works. They don't necessarily want to read the research paper and the ethics behind it. As long as they've been told it's safe and it works, they're quite happy to get on with it. And then you've also got to balance that with actually what questions would get funded, you know. So I think that was quite a thing of how do we put this into research language, and then it automatically, I guess, becomes a bit further removed from the kind of service user, you know, ground level conversations.
I definitely want to come on to talking about how we answer these questions, and also how we get these questions to the people that might be able to research and answer them, and how we fund that research. That might be a nice thing to finish on, Sophie. But before we do that, we've had a question come in from Twitter from Lucy Simons, who was the project manager for this project. Yeah, the energy and the brains behind the PSP. Thanks, Jen, definitely. And she asks, does current research underway by panel members begin to address these priorities? And I suppose what she's thinking of here is that it's taken a couple of years for us to come up with this list, and we were kind of conscious that we might be, you know, out of date by the time they're published. So what do the researchers on the panel and the people that are familiar with research on the panel think of that? Do you think we are, you know, have we still got an active list of questions here that we can give to people?
Can I come in here?
Oh, yeah.
Can you hear me okay?
Yeah.
Okay, great. So I guess just to say that certainly we, and I know other people are doing research looking at digital technology that is integrated within face-to-face contact. So we're particularly involved in developing apps that are involved trying to help inform shared decision-making and empowerment of people within the context of ongoing contact. So we didn't frame it, we didn't develop it because of that question, but it was something that came out of our work about shared decision-making and how to increase the relationship between people. So I guess it does speak to that top question, which is great. But the second thing, I suppose, where sort of our research is moving, and it'd be interesting to know what other panel members feel in terms of the wider issue, is I suppose it's slightly challenging the idea that the gold standard is one-to-one face therapy in a room, and that everything apart from that is a sort of deviation from it that we've got to try and justify or worry about or risk manage, and moving to a concept of saying, well, actually, and I think it links to what Mark was saying, what is this? What are the best ways of helping with mental health? And those may, and digital in a way is a medium, but there may be millions of other things that we haven't even started to think about. So we've become interested in, you know, how people use their own self and what we're now calling self and community strategies. So for us, then it's sort of digital and face-to-face all become part of a great panoply of over 133 things that people do to support their mental health, and trying to understand, so sort of addressing the risks and benefits of all of those, rather than sort of pulling out digital as though this was the sort of key problem that we've got at the moment. And I think the third thing with that is the challenge back on the sort of more general digital space. You know, I've heard colleagues in research who work in digital, not particularly mental health, but on the impact of digital on children's development and on psychological development generally, saying it's the equivalent to us saying, well, how much screen time do you have? Well, how much paper time do you have? You know, we don't talk about other technologies in the same context. So I think there's also a move, certainly amongst the people I link with, which is not amongst all people, a move away from this moral panic around digital is something terrifying and unusual and has to be treated in its own category. A way to think of there's a whole range of categories of things we do. I mean, we need to think about harms of face-to-face as much as we need to think about harms of not face-to-face. We need to think about all the different panoply of things. So I suppose it's about expanding that rather than narrowing down to digital.
Thank you very much. Yeah, there's a lot in there. We could go in lots of different directions, but before we do, Kathy, do you want to come in and say a little bit about your perspective on that?
Yeah, so I'm in relation to the question of, you know, are these questions still relevant? I think my answer would be yes, very much so. I mean, unfortunately, research moves slowly. And this is one of our real risks in the field of digital mental health, is that lots of other aspects are moving really quickly and we're sort of struggling to keep up with the evidence. And even where we do have evidence, so as I said, my area is childhood anxiety disorders, and we've got a couple of, I mean, it's small numbers, but we have a couple of trials now that have shown really good outcomes for online guided self-help type treatments for child anxiety. And actually a couple of studies which have shown very similar outcomes from face-to-face and those kind of online approaches. And a recent Swedish study showing, you know, really good economic benefits of the online approach. So that evidence is emerging, but actually we may have found that for child anxiety disorders, but that doesn't mean the same is going to be true for other sorts of difficulties that people might experience. I mean, the challenge is going to be, a funder is going to be interested in asking the same questions for different sorts of difficulties, because this is one of the challenges that you have, you know, is that sufficiently novel and exciting for funders, because they obviously have limited budgets to work with. So we need to find ways to, you know, really make sure that there is a real drive to get these kind of questions answered, because I think that we're certainly a long way from that now. And I'd be interested to hear other people's thoughts on this. So one of my concerns is that I think we have these questions, they're really useful, but how can we motivate, you know, the drive to get them answered? Because, you know, clinical services are at full capacity. If there's something there that seems cheaper and quicker to get out, then they're going to want to grab it and get it out there, evidence or no evidence, because so much of it's about meeting targets to just get people through the door, regardless of what they're then offered. Similarly, if companies, you know, are going to have, they can't sit on these things for too long. They need to get them in the marketplace, or how is it going to pay its way? So where's the drive to actually do the research to answer these questions about risks and benefits? And I think that needs to be that drive needs to be manufactured and created to make sure those things happen. So I'd be really interested in people's thoughts about how that can be pushed forwards.
Thank you. Yeah, that's a cross for you to nod in, I think, Sophie, isn't it? So what's your view on this kind of dichotomy almost that we've got? That researchers want to fund the sexy new stuff, and yet we've got these really basic fundamental questions that we need to be answering. Do you think those are going to get funded?
I think that there's a huge desire to fund this research, and we certainly see at MQ a lot of applications for digital technology. I think Kathy touched on one of the big problems is around the amount of money. So a funder is, you know, willing to give money for a small pilot study to get the, you know, to get some evidence behind it. But to actually scale that up, it's not much different to a pharmacological intervention, where to get something that is, you know, truly interactive, that's in line with the rest of other digital technology in terms of the way people are using technology, is expensive. You need the app developers, you need the technology behind it, because, you know, young people, for example, are used to gaming. These are very engaging, very expensive platforms that an avatar, a little stickman avatar that's delivering some CBT isn't really going to quite cut the mustard. So to try and get something that's equally engaging is going to take an awful lot of development. And I think if we need to do that, the app developers need to get involved much earlier on. And as I alluded to at the start, that we get a bit of frustration that the app developers are out there wanting to do this, and they're just delivering non-intervention based evidence. And if we could just find a way of actually marrying the scientists with the app developers right from the start, I think a huge amount of progress could be made, as long as we always focused on the evidence base at the end of it.
Yeah, but that's been the mantra, hasn't it, in digital mental health circles for at least 6 years. I remember when I first met Victoria and Mark, that's what everyone said at the end of every conversation. If only we could get the people with lived experience and the clinicians and the researchers and the developers together and all have a lovely chat. I mean, so Sean, what's your perspective on this whole situation? What's the role of developers in research?
I think from developer point of view, we have a big role to play. From Cypher's point of view, we've made it part of our mantra from the early onset to make sure we have a lot of service users to engage with our developers in terms of during development phases. And we've always engaged with youth clubs and schools and places in general. So I totally agree with that. But what worries me, as you alluded to 6 years ago, when you met Victoria and Mark, the same question, same thing was coming up at the end of every conversation, and it's going on for the past 6 years. And when is that going to change? When are we going to actually, start taking a bit more, dare I say, from a developer's point of view, start taking a little bit more risk? I get, the whole research side of things is very important, and we need that. And as I alluded to earlier, from Cypher's point of view, we need to do more of that. But I think there needs to be a fine balance. And then one of the things I've also propped up earlier, which Mark also mentioned, is around, some of the questions are great, but it feels to me like it might just not be keeping up with in terms of how everything else is moving in the world. And that really concerns me. I feel at this point, I'm not necessarily super confident thinking in 6 years' time, are we going to be like, is mental health, digital mental health is going to be on the same wavelength in terms of how the service users themselves, in terms of what they need, and how technology is fast moving, are they going to be on the same wavelength? I worry that in 6 years' time, it's not going to be the same. And that really worries me. And I think we need to put more effort into trying to actually, as we say from the development world, we need to ship more products, frankly, and test more stuff out there.
So what's the gap there? Is this simply that researchers are keen to do the kinds of studies that don't fit with developers, way of working? I suppose.
I think it's slightly a bit of that, and I think from my point of view, I'm the type of person that's happy to compromise. So I don't mind being more interested in terms of what the researchers want to do. But I think from developer point of view, often actually developers do consider a lot of the, from developer point of view, they'll be thinking of like UI and UX and stuff like that. Whereas actually researchers, not to say I'm not saying they don't think of that, but actually it's not necessarily, they're more interested in terms of like, the outcomes and all of that, which is good. There needs to be a fine balance between the two. I'm not sure how else to try and break it down without sounding totally wrong.
But you need to have good UX and you need to have good design in order to produce outcomes, and that's why you need that balance between, the technical and the design expertise of developers and designers, the academic rigor, and then that really important co-design process where the people who are going to be using digital tools and services are involved in developing, designing them and testing them as well. So I think, Andre, you're completely right. We need to sort of have that sort of balance. And if you just have one discipline and not the others, then you end up with something fairly substandard.
Yeah, if I can also add, perhaps maybe, I know I'm aware that, there's a few, one way to try and, make this happen faster is around, having more mental health hackathons. I think, doing stuff that is more, rapid prototyping, but actually having researchers in there might also be something that needs to be funded more, just so we need to experiment much faster, but with, the UX designers and UI designers and the researchers on board.
So who's been involved in hackathons on the panel that would like to give us an example of how that works? And yep, Mark?
Well, it depends on how you run the hackathon, and it depends on what you're doing. I think there's an interesting challenge about hackathons because sometimes they turn into the equivalent of consultations, but just kind of sexier and more techy. So you end up often kind of setting a provocation, setting a problem to solve, and everyone's been thinking about it, not for 6 months, not for 6 years, not for 6 decades. They've been thinking about it for about 30 minutes. And what you end up with often is the same ideas that everyone else always ends up with when they've thought about a particular problem for 30 minutes. I think it's really interesting. And this is another kind of area where I was thinking about the questions, in that the questions that came out of this process for me, because they're very big and very general, they don't really create specific problems to answer or specific problems to look at. And it's a bit like trying to grab mist in some respects. And I know there's very good reasons for making them very general. And it's the same thing that happens at hackathons, is setting a very, very general problem and then arriving with a very, very general solution, which even if you were to build it, would be very, very difficult to research because it's very nebulous and difficult. And I think with a lot of the stuff around research in digital and mental health, there's a sense in which we don't actually really quite know with a degree of fineness what it is we're actually experimenting with, or what it is we're trying to test, or what the effective element or component of the intervention or the service is. So we can't really replicate the thing that's being tested because we can't isolate it from the way in which it's being delivered. And I think that's a really big challenge with digital, in the way you deliver something is the same as what it is. Like the amount of research papers I read about digital interventions in mental health where they don't actually describe the actual digital method of delivery. They don't say what it's built in, they don't say how it was built, they just go, and there was a program. And I think we have a real problem with this when we treat digital mental health as if it's like a big overall thing, like a massive umbrella. And it's not, it's loads of different specific things. And I don't think we're very good at having the conversation about the small specific things. And that's ultimately where kind of developing stuff comes from, is kind of solving very small specific problems, even if there's lots of very small specific problems all grouped together into one problem.
I feel like we do that with mental health generally. You know, Geraldine Strathy's thing of we talk about mental health as a block. We don't really so much talk about physical health that way. So I think we almost do ourselves a disservice to begin with, because, you know, there is this cultural view of mental health, but then physical health is diabetes and COPD and cancer and all sorts of conditions. But yeah, it's hard for us to get past this idea of mental health as all one thing. And so you end up with really general stuff, because something that's going to help someone with low level anxiety is probably not going to do anything for someone with, 3 decades of, experience of psychosis, or, even me and my best friend with the same condition might need totally different tools because of the nuance of our conditions.
Yeah. But do you think that's compounded also by the fact that there's so little money in mental health, or has been until very recently, that everyone's off creating their own little app, and everyone's got the idea, all I need to do is make a lovely app, it's going to be beautiful. And, and there's no sense of actually just how much money is involved in making anything that's even halfway decent.
Yeah,
and we don't learn from each other. So everyone's going off with the same. And I really take Mark's point, having thought about it even for 10 years, they've all got the same idea, and then they're all off herring doing it. And I suppose I was wondering from the panel, what's the best app you think is out there at the moment? That we, should we all just be combining our energies and saying, let's go for the best app and let's just get it really good? Doesn't matter what it's to do with. Is there an app that's actually out there at the moment that we all think this is brilliant? This is something we really want to sort of develop further, and maybe we should put our energies into one thing.
I think there's come in on this.
All right, go on, Chris.
If that's okay. I think there were questions getting back to understanding something about the mechanisms of how these interventions and technologies work, because when we do tend to lump them together, as Mark said, and one of the problems is if we've got 300,000 apps, we can't evaluate and trials of 300,000 apps. We need to understand what are the common features, what are the differences, what are the active ingredients, what are not, and that involves the technology as well as the kind of theory and what's thinking, what the mechanisms of change are, which allows us to kind of incrementally move forward rather than saying, we treat every single intervention as though they're completely unique and separate. Well, they're clearly not. So that it would involve a taxonomy of some form that we could begin to combine and bring active ingredients together, test them. And for a developer, they could then say, well, we can use this, or we could adopt this process, or we could take this forward. So we have a little bit more of a science of these technologies, rather than treating them as though they're really weird, strange, unique things that somebody has just come up with, and saying what is the best. In a way, at the moment, we need to go beyond that and say, well, why is it? What makes it work? Because that will allow someone to build something in increments and take it forward. What we also need is an infrastructure to do that testing. We need the kind of platforms. We have a unique potential with digital to generate data, very rich data, but most of it is completely inaccessible, particularly for research. So you have all of this technology that's being developed, but we have research processes that aren't fit for purpose. So within services or generally, we're not able to access this data. And we need to have that trust to allow us to do that, because that's the only way we're going to move forward and improve what we're doing. And the way that research is set up is really legacy structures around, as you said, pharmaceuticals or around traditional interventions. And so the systems of research, which is probably not quite what this JLA was getting at, but it has raised questions about, what the methods are for evaluating apps. And that was one of the questions. So there are issues actually here around methodology, infrastructure, the way we do research, which are really, really, really critical, because it's not just putting more money at it, it's how we do it in a way that we begin to, resolve issues for Sean as well, and for the the developers, that we can actually do something useful.
I think this is the opportunity now for the researchers to get out of the labs and go and work within industry to help them make the case for the effectiveness of their products, instead of what we see, which is researchers trying to create products which they're not always very good at, and then they fall over as soon as they get out into the field. So this is about people playing to their strengths, really, the collaborative effort.
Can I ask a question? For Chris and Matt, about multidisciplinary research, and thinking particularly about question 10 and about social media. And there's a really rich social sciences and media and communications research around social media, for example. So in terms of who does the research, do you think there's a case for broadening out beyond mental health specific researchers? We broaden out the disciplines involved in undertaking that research to develop that richness?
Well, absolutely. I mean, I think one of the things that distinguishes this field in some ways is just incredibly broad in terms of disciplines. I mean, going right from, humanities, social sciences, Victoria talked about ethics, through to computer science, engineering, human factors. And I just think, the way we structure research in terms of our mental health research community clearly is inadequate. We've had to go way beyond that. Your network, the UKRI Mental Health Networks, again, part of one, the eNurture network, which is addressing the risks as well as benefits of digital technology. These concerns, sometimes the scare stories which aren't substantiated, that is humanities and social science research, and it's great that that's being supported and funded, and hopefully will influence policy. We deliberately made a decision not to go into the area of general harms of technology, simply because we couldn't take that on. It just wouldn't have been feasible. So it's not that we didn't think it was important, but we didn't address that broader issue. But it's absolutely critical, yeah.
Can you say something, Kathy, about the new Emerging Minds network? You mentioned that already, but how do you think that kind of initiative, so that's a 3-year project, and it's going to be bringing together a research network around young people's mental health. How are you looking at these kind of digital questions in the context of that?
Well, we're at an early stage. Well, we haven't actually started yet. We'll start in December. And the very first thing that we'll be doing picks up on, I think, what everyone's been saying about the importance of, bringing everyone together, just as been done in this priority setting exercise. So at the very early stage of the network, we'll be doing a lot of engagement work with Young Minds and the Centre for Mental Health, helping us to really make sure the voices of young people, their carers, and people who work with young people and their carers are helping us decide what the key challenges should be for our network in order to sort of really make a difference to child and adolescent mental health. And so actually these priority questions will be really useful for us to feed into those discussions to help those groups to help us to tell the academics and their colleagues where to focus. So we're at quite an early stage in determining how that goes. But some of the key things in how we, what we'll be doing is facilitating co-creation of research projects involving academics, potential users of the research, and from all different places. And we'll be prioritising an interdisciplinary approach, and we'll be prioritising studies that really do have meaningful involvement of the people who are going to use the outputs. And so, hopefully we'll be able to pick up on quite a lot of the things that have been raised today, as well as the things that have been raised in the priority setting exercise. The other thing I wanted to say a bit earlier on, not based on hackathon, but when people were talking about, industry, people working together with academics and working with service users. So we have, this is something that, and there was a question about research that we've been doing that's relevant. That is something that we've been doing over the last couple of years. We had a treatment for child anxiety disorders where we sort of support and empower parents to apply CBT principles in their child's day-to-day life, and we know it's an effective treatment. And parents asked us to make it available online because often they're doing these things, many parents work, have other children, so actually finding the time to come to appointments and so on is very challenging, and it rules out quite a lot of people. So parents asked us to make it available online so they could do it at the times that suit them, and that's what we've been able to do. We were able to get funding from the NIHR, but we had to go through a long tender process, and then we went through a very thorough co-design process, working with parents, with children, with clinicians, and with an industrial partner. And we're just coming to the point where we're going to start evaluating it, and that's 3 years on. So I think that's, that is the other side of it, is that we can do those things, and we have done that. And it's actually, we're really pleased, and the families that have been involved have been really pleased and really positive about the outcomes. But it takes a lot of time to do that. And I can see that that's really challenging for industrial partners, because, things cost, two, for families who are really keen to just get on with it and have access to these kind of tools, and three, by the time these things are ready, are they then redundant and out of date, and has someone else saturated the market with something that doesn't have an evidence base in the meantime? So I think we can do those things, but we have to recognize that it comes with other disadvantages and challenges that we have to find ways to manage.
Doesn't that just play to Miranda's point earlier about the fact that there's, hundreds, thousands of CBT apps? Why are we all developing the same thing? So, that's a difficult question to answer, though, isn't it, Miranda? Go on, Mark.
Well, because we exist in a series of markets, and there's no way of getting away from that. That who owns things gives them power over what happens to them, and the idea that kind of research about mental health apps can exist in a kind of glorious kind of academic Tim Berners-Lee doing this for the great of humanity situation and be able to change the world is kind of unlikely. So it's unfortunate. Like what can you say to someone who wants to develop a CBT based app? The only thing you can say is, please don't do it and kill anyone by doing it really badly. But you can't stop anyone. There's no law against it. And I think it's interesting. You'll never be able to stop someone doing a really stupid.
No, but I think we could do more as a community to share knowledge about what actually is working. So I agree with you. We're in a capitalist system, and that's the way it works. But I think already, so I think the fact that the funders chose to give whatever it was, 4 million or whatever, to one app developer, and that there are these calls now saying we're going to give a lot of money to one thing, actually is possibly a force for the good, in the sense that actually it focuses on one thing. And as with any capitalist system, what will happen is we're in the Wild West at the moment, and eventually some market leaders will emerge and they'll get invested, and they'll be the thing. It's just a question. So you can't stop anyone trying to be that market leader, but at some point that will happen. But we as a research community and a community committed to supporting young people with mental health issues could do more to share our knowledge of what actually works out there. And there's no magic way of keeping on top of it, because there's millions of them. But I guess it's just trying to share. So, we each said what was our one thing, not one that we've developed, one that we have seen that we think is really helpful. If we almost had some Delphi consultation around that, where you were precluded from mentioning anything you'd been involved in,
But I think there's the opportunity. Oh, sorry.
Go on, Sophie.
Yeah, so I was going to say, because I think that the opportunity here is to move beyond the kind of Delphi iteration, that the iteration becomes within an online platform where there's a platform that is taking different researchers' ideas and then going through a Delphi process by which the users are really feeding back. And there's more this sort of real-time optimization of, for example, CBT or whatever type therapy, but within an existing platform, rather than everyone going away and trying to develop all these different platforms and then shoehorn some kind of existing therapy to turn it on its head. And then it changes the meaning of what evidence would be within it. But it's almost like that what people are actually voting on their feet to use and feeding back in terms of what's effective, whilst the data has been being gathered.
And I think critically, and Miranda will probably have more to say about this than me, that these things must include ways for us to assess outcomes in meaningful ways and in ways that are comparable, which I think is really not generally the case for a lot of these things. It requires then additional research on top. But actually, I think, as been said a few times, one of the real benefits, as well as access and fidelity of these digital interventions, is that we can build in our routine outcome monitoring. So it's just part of the process. You can't forget to do it because it's built in. And that's what we've done within our program, and what we'd really like to see is that happening across the board so that we can compare and we can see very clearly which ones are working and what's working for whom, and also, as Chris was saying, and start to take things apart a bit and understand what it is that makes things work better and what can be shared.
Yeah, Sean, do you want to come in?
I just want to add that from the point of view of like when there's hundreds of thousands of apps, digital mental health apps out there. Like, I think a lot of some of the pressure that we face internally and also like with our mentors is around, like, for example, I'm advocating, and even after participating in this conversation, I think I'm going to go back to the rest of our team to try and push for this. Just actually, I think it will be much better. We will be in a much better place if we can actually somewhat open source our insight. So that way actually allows researchers to actually do something with that, actually allow people to actually have access to what's been going on, what's been working on, what impacts have been working on. So some of the feedback that we've had, that's kind of like a bit of pressure on us, like in terms of like, actually, we need to hold on to everything, whatever, because these are IP that we can monetize down the line, whatever. There's that pressure to try and, generate revenue. So therefore, we've actually been reluctant to doing certain things over the past few months. So I'm just putting out there that's something for us. My learning takeaway from this, actually, we need to put it out there. Just have a look about all the interesting stuff that's been happening, and to allow researchers to make whatever they want to make out of that. And hopefully there'll be some learning from that for everyone in general. And I think we need to do more of that kind of stuff.
Great, thank you. Victoria, I saw a big smile on your face while Sean was talking there. Do you want to come in?
No, it was nothing to do with what Sean was saying.
Okay.
To do with that. Sorry, he's been jumping all over me whilst I've been talking. But absolutely, it's I think that developers often aren't incentivized to be generating evidence, and we've got to make it as easy as possible for developers to generate the right evidence and to build in collecting the right data from the outset. So it's about how we work with developers so they can start thinking evidence right from the get-go. Right, maybe when they've developed their app or their digital intervention and they haven't built in the right way of capturing data.
Yeah, absolutely.
Solve, don't we?
Yeah. I want to get a couple of more questions in from Twitter if we can. We've only got 5 minutes left. So Shirley Ayres, the lovely Shirley Ayres, hi Shirley, has asked, how many people with lived experience of using mental health services are actually involved in the design and development of digital resources? So we've seen this massive kind of, co-production is in every single mental health tweet that's ever been written in the last year, I think. So has that kind of service user-led, survivor-led research kind of bled into digital? Yeah, Miranda?
I think it has. Certainly it has in our research, and I know in others. But I don't think it solves every problem. So it's a minimum, not a, it doesn't get you out of all the issues. And I suppose I want to go back to what Mark was saying earlier, that actually designing these things is complicated, whoever's experience, whatever expertise you're bringing, and the relationship with the IT providers on it is complicated, and the language, trying to explain what you want and what you need and what you think you need and what you actually need are complicated for everyone. So I suppose I just wouldn't want to. I don't think this is primarily a problem of professionals going along and doing it anymore and thinking they don't need to involve services. I think they are. It still is problematic.
And is the way that we co-produce services and research in digital the same as the way we do it elsewhere? Kat, you were saying earlier about, the product has to be very different for two people who are actually quite similar. Is there something particular about digital co-production that we need to think about here, or is it just the same?
I would say that having been in mental health services since I was 14, it wasn't until I was 19 that I actually heard the word participation. And I heard that because I started doing work with young minds. And at that point, the concept of actually being asked about my care or the service I was receiving or anything was kind of mind-blowing that anyone would want my opinion. And, even now, after on and off 15 years in services, I don't think I've ever been asked anything more than what colour I'd like the waiting rooms. So, to the point where, like, even trying to do a care plan, a paper care plan, that's not been the case for co-production, which is very frustrating when you've kind of fought a long time for things like co-production in services. So I don't think it's just limited to digital. I think, to be honest, there is still this view for a lot of people that participation is a nice to have, but it is that added extra. It would be nice to involve these people, but they're hard to reach, or we don't have time. And I get particularly frustrated when we talk about men being hard to reach, because I'm like, what, 50% of the population? It's kind of, it's very, very frustrating, I guess, to have all these lovely, I guess, like Mark was saying, these lovely academic conversations about how beautiful and utopic it could be. But then personally, I don't see that replicated in my care. And the only reason I'd say that I'm involved in projects like this is because I've been putting myself out there and campaigning and talking and pushing for better digital mental health stuff.
Yeah, thank you. Sophie, I wanted to kind of end by asking the research funder in the room, and obviously others here are involved in funding research and running networks, etc. But how do you see these questions and this type of question that we have in the project getting answered? How do you see us bridging this gap between what we have here with this project and the big research funders?
I think it's been touched on before around the questions are, at the moment, they're very broad. They're not tractable research questions as they're written. Now, that's not a problem because it gives a number of different ways that people can approach the question. I think the challenge is at the moment that there are, to take this to the funders ourselves, the big funders, and really persuade them that to have a specific call about them, because at the moment these would fit into various calls along the way and various the other ones to the other funders, but it's around actually how do we really turn these questions into something meaningful. We work very closely with the other funders. We've been talking to them, in fact I had a meeting with them today, about actually how do we take this whole process, the JLAs, bring them into the process a little bit more, because at the moment, whether it's this one, whether it's the depression one we did a few years ago and various others that have come out, how do we make these really, really meaningful? There's a lot of time, effort and money that goes into these. How do we ensure that these are then translated into funding? Because at the moment, I've not seen any calls that have been based on the questions that have come out in a PSP. And it would be fantastic if funders committed to do something with these. We see them a lot in applications. We'll see an application or a research methodology that's then in the first, that as identified in such and such top 10. And what we really need to do is, I think, that get the commitment from the funders up front to say, well, actually, we're committed to taking these questions and doing something with them.
It feels like we also need some research into the best way to bring together all these different types of people to get them to work together I'm not sure that anybody's researching that, but that's certainly an area that we seem to be.
That's another research question in itself. But I think I think that whenever that there's a sort of interdisciplinary problem and the need for co-production, the first step is just getting the right people in a room together with the funders and giving them a challenge and a forum and the time to actually come out with it. But then I'm mindful, as you said, 6 years ago, you were doing the same thing and nothing really changes. So I think the system needs to change a little bit. That there isn't just this sort of, funding call, applications, everyone working separately and competing for the money, that there needs to be a bit more coordination, collaboration up front to think about how these questions are then addressed.
Okay, thank you. I'm going to finish by asking everybody Miranda's question. I'm going to force you all to tell us what the one app that you think, and I'm going to start, so give you a few seconds to think of it. What's the one app that you use that you would recommend to somebody else? For me, this is bizarre, as the person that kind of developed a reputation as hating mindfulness, it's the Headspace app. That's the app that I've used that I've had the most personal benefit from. Victoria, how about you?
Oh, this is a nightmare. The app that I'm using at the moment, and I can't actually think what its name is, but I use a running app. So I'm doing a lot of training at the moment, and I find running really clears my head and is very good for my mental health and well-being. And also knowing what speed I'm going per kilometre helps as well.
Can't remember what it's called. This is just an attempt to raise some money for your marathon donations project, isn't it? Yeah, absolutely. How about you, Matt? What's yours?
It's WhatsApp. It's not a mental health app, but I use it a lot. I'm a PhD researcher now, which is very lonely. So for keeping in touch, it's fantastic.
Yeah, brilliant. Chris?
Well, you saw my thunder on that one, Andre. So Headspace, again, it's not a real endorsement. I don't have much evidence, but for me, I think it's beautifully put together and really, it's been good.
Yeah. Miranda, how about you? Oh, we've lost you. Are you muted? No?
Actually, I like Headspace too. And I'm just going to creep in another one that I've just recently downloaded, but then I've got logged out of. It looks quite interesting, called Shine. And I'm trying it out and seeing what that's like.
Shine. Right, nice. Okay, cool. Mark?
Google Assistant and other things that link other apps together are where that is most useful for me, because I'm basically a cyborg, and without my phone and other digital services, my life just falls into disarray. It just spirals down to nothing, and I just wander around like a bee cut off from its hive.
Oh, beautiful. Another beautiful image for us to take away. How about you, Sean?
I have to say WhatsApp as well. I think that it's the simplicity of it, and just being able to, reach out to any of my colleagues and friends whenever I want to. I think it's quite powerful.
Yeah. Okay, cool. How about you, Kat?
I actually had to go through my phone and check if I have any mental health apps these days. And I think I have this habit of starting and then stopping. So I didn't even get past the first 7 days of Headspace a couple of times. So, I mean, to be honest, this might be a bit controversial, but it's Twitter. I think the mental health community is incredible, and the amount of peer support, but also the interaction between professionals and service users, and the fact it's 24/7 support for me, which mental health services aren't, is great.
Thank you. Yeah, absolutely. Kathy?
Yeah, so I'm going to struggle to have a favourite mental health app, just because I am so, orientated on evidence, and so I immediately am put off when I think things are out there without any. But I did the same. I just flicked through my phone thinking, what's my favourite app? So a more general app, and I think it's definitely good for my well-being, is one that my kids' school use to keep us up to date and remind us what forms and bits and bobs we're supposed to be bringing in the next day. And it's brilliant. So, and that's one called Class Dojo. And I can get little updates so that when I would have otherwise forgotten a particular bit of PE kit or whatever, the teacher has given us a very handy reminder.
Nice. And Sophie, what about you?
Oh, apart from wanting that app, Kathy, I suppose that I was a little bit torn between the various tracking apps I use. I use MyFitnessPal, Sleep Cycle and Life Cycle, just generally guilt me into inaction. But I think the one that actually I use most of all and really helps me keep focused is Wunderlist. It's just a to-do list app, and it means that I can put everything I need to remember in that app. If it doesn't go in Wunderlist, it doesn't happen, but it's my way of sort of organizing my thoughts and knowing what I need to do and then not worrying and thinking about what I've not done for the day. So I think Wunderlist gets my vote. And it gives a wonderful ding when you take something off.
Oh, dings, those are good.
Yeah.
Thank you so much for joining us, everyone. Thanks for people who've watched. Keep the tweets coming at Digital MHQ. And yeah, see you soon.
See you later.
Thank you.
Bye, thank you.